Hello, welcome to the technical breakout session for theme 2, Reopen Schools Safely. Before we go on, I want to remind you to please choose the language channel that you need. Under interpretation bar, you have a choice of French and Spanish. French and English, no Spanish. I'm Suzanne Grant-Lewis. I'm the director of UNESCO's International Institute for Educational Planning, or IIEP. I had the great privilege of serving on behalf of UNESCO as the penholder of the Secretary General's policy brief on education during COVID-19 and beyond. And so it is a special pleasure to be with you today to discuss our theme of reopening schools safely. Our objective during this 1 hour and 20 minutes together is to bring your experiences, the lessons you have learned, and your sense of the remaining challenges into a reflection on safely reopening educational institutions and meeting the commitments in the draft 2020 GEM Declaration. I draw your attention to Section 7 of that draft declaration, focused on priority actions, and specifically the first bullet. Let me frame the discussion briefly and explain how we will proceed. The Secretary General's policy brief, and indeed the background document for this meeting, highlight the many ways that the COVID-19 pandemic has stressed students, teachers, parents, and the wider community. They have experienced the loss of nutrition, health, and psychosocial support that schools provide. They've experienced the loss of family income and increased child abuse and violence. As many countries start reopening schools, we must consider school hygiene, safety, and nutrition, as well as the mental and psychological health of students, teachers, other school personnel, and families. We remained concerned about the impact of prolonged school closures on learning and well-being, and we want to ensure that conditions for reopening schools are met. These conditions include the safe and hygienic environments, the availability of school personnel, and the capacity of education institutions to implement changes and remedial actions, such as accelerated learning strategies and adjustments of the school calendar, curriculum, and classroom organization. To safely reopen schools requires that we take into account the local context and COVID-19 infection levels. For that reason, we'll be hearing from examples from several countries on how they went about doing this. Strategies to safely reopen schools also require trust. And in building trust, our watchwords must be consultation, communication, and coordination among education and other ministries, as well as within the school community. That includes students, parents, teachers, and other education personnel. I'm pleased to introduce our rapporteur, Carmen Burbano, who is Director of School-Based Programs at the World Food Program. I'm sure you join me in congratulating Carmen and her World Food Program colleagues for the recently awarded Nobel Peace Prize. So let me now walk you through the format of our session. We will start with Dr. Anshu Banerjee of WHO sharing with us an opening presentation. We will then hear from a series of 4 speakers reflecting on their experiences, each speaking for only 5 minutes. We'll hear from 3 country representatives and the UNESCO chair in global health education. They'll be trying to answer the questions related to our theme today, including the question, how will you take forward the commitments in the draft 2020 GEM Declaration in your country or context? This is the question for each of us today. We will then open it up to participants for very short interventions of less than 2 minutes each, please. I'll then call on participants so you can use the raised hand function to enable video and audio, or write in the question and answer or chat box. Following about 15-20 minutes of questions and answers, the rapporteur will then present the main takeaways of the discussion before closing and returning to the plenary. I'm now very pleased to introduce our opening speaker, Dr. Anshu Banerjee, who is WHO's Director of the Department of Maternal, Newborn, Child and Adolescent Health and Aging. Dr. Banerjee, you have the floor.
Thank you very much, Suzanne. And I'll try to build on your introductory remarks because I think you're really painted sort of the scene of what we are looking at and what we're dealing with. Let me just put up the slides. And I think we're in slide mode now. So what do we actually know about the background of COVID-19 in children? We know, and I'll have another slide after this, showing this a bit more clearly, but we know that compared to the overall proportion of children, let's say, and young people compared to the overall population, the proportion of cases was actually quite low, between 1 to 8% in most of the countries. And this relatively lower number of cases could have been either because they were less susceptible or because they transmitted, let's say they were less likely to transmit infection, and at the same time also because of these symptoms which were generally milder, they were maybe not actually picked up, and therefore children were not diagnosed with COVID. But there's still a lot uncertain about how the transmission actually works, but there are a few things that we are learning at the moment. So maybe just to show these two graphs that show that, first of all, most of the COVID cases were, of course, in the adult population, much fewer in young children, as well as fewer also in the older population. But when we look at mortality, so the right side of the slide, we see that most of the mortality was actually in the higher age groups. And though there was less infection there, they contributed to the majority of mortality. Children, however, were spared very much from severe disease as well as from deaths. And so what is the evidence of the role that children play in COVID transmission? So there is some evidence now that children and young people actually play a lesser role in transmission at the population level. We also know that the prevalence of infection between pupils and staff has been more or less the same. Yeah, we know that there is some evidence that suggests that children may be less infectious than adults. However, the evidence from studies is still inconclusive. We know that for children or people less than 20 years old, they are half as susceptible to infection as people above 20 years. And this is identified in a few countries. So we're not yet sure whether we can extrapolate this to the global population, but these are some of the findings that we have found. And at the same time, children are unlikely to have been the primary source of household infections. We know that in a few countries, schools have been at the center of outbreaks, such as, for example, in Israel, but this is not generalizable. And so for that reason, we do feel that schools need to be kept open, but additional measures should be taken to minimize the risk of transmission in schools. And why do we feel that schools need to remain open? And I think Suzanne has already alluded to that, but it's because it's not only the educational, let's say the impact on the educational outcomes that closing of schools will have on children, but there are many other negative impacts as well. So for example, on food systems and the risk of food insecurity for many children as well as for families. A recent estimate also projects an increase in 2020 of approximately 40 to 60 million additional children that would be living in monetary poor households. Children are at the risk of increased exposure to violence and maltreatment due to disruption in household economic and food security. And so when they stay at home and they can't go to school, they're much likely to be subjugated to this violence. And projections from 2020 to 2030 suggest that the indirect consequences of the COVID pandemic could result in an additional 13 million children or child marriages taking place that would otherwise not have occurred because these girls would have stayed in school. So there are many reasons besides educational benefits why it's important to keep schools open within this pandemic, but we have to do it safely. And so what are some of the strategies that have been guiding countries on how to do this? So we have to look at a balance between pandemic containment and therefore making schools safe, as well as the continuity of full-time education and school-linked preventive services, whether they're mental health services or school meals or other kind of programs, such as deworming programs. And in order to do so, we have to really look at the context of transmission within the community versus the context of the educational process and setting. And so when we look at the pandemic containment on the left side, there are measures that we can put in place, such as physical distancing, respiratory etiquette, hand hygiene, and early detection and contact tracing. And on the other hand, when it comes to the educational setting and continuity of full-time education, we need to look at attendance, but also equity and quality and health and well-being of both students and staff. And so some of the strategies, so again, on the pandemic side, I think I've already highlighted most of them, such as the respiratory etiquette, hand hygiene, physical distancing, but there are also environmental measures that can be put in place, ensuring early detection and also testing and contact tracing. And on the other side, there are strategies that we can put in place in order to make schools safe environments. So for example, we can have children come on alternate days to the school, and not that all children come to school at the same time in order to avoid overcrowding in schools. We can have staggering. This means that different classes do not have their breaks at the same time. And so when children have their lunch break, it's not that all children will mingle at the same time, but it's contained and smaller groups of children will be having their lunch breaks at different times. We're looking at bubbling meaning that a small group of children are the ones that interact with each other and don't interact with other bubbles, so that when someone is either a contact or a primary case, a COVID case within that bubble, we only have to contain and do isolation, let's say, of those children within that bubble. And so the other children will still be able to continue their education. We can look at reduction of class size, and that of course is related to the size of the classrooms and how many children would comfortably sit there with proper physical distance. We can look at differential use of masks and personal protective equipment. For example, around masks, we have guidance that for all children, so from 12 and above, it might be useful to wear masks, but for children under the age of 12, it might be less useful. We can ensure that there is intensified hand hygiene when children come to the school, when they go to the bathroom, before and after breaks, improve ventilation and environmental cleaning. We can look at blended learning, so that some of the learning might be online and some might be face-to-face. But we of course have to keep also in mind the digital divide and equity and make sure that all children actually can benefit from education. We can look at attendance and entry rules, for example, making sure that parents, if they think that their child is sick, doesn't come to the school in order to avoid potential transmission and really stick to this rule. We can look at reorganization of physical space, such as removing equipment that is not needed in the classroom in order to reduce surfaces that could, let's say, harbor virus. Look at also reorganization of school transportation, such as looking at drop-off points, looking how where parents can pick up and drop off their children, or looking at school transportation by buses to make also these more safe and look at physical distancing. And of course, managing behavior, both of teachers, other staff in the school, and of children. So these are some of the key issues that or strategies that countries can put in place. I just wanted to give a quick overview, and I hope that during the following discussions and from our country panels, we can really hear how they have taken these kind of strategies and made them, let's say, workable, and to see which ones were most feasible and which ones they thought had most impact. Suzanne, thank you very much, and over to you.
Thank you very much, Dr. Banerjee. This was really extremely helpful. Not only did you share with us the latest evidence, but also the rationale for keeping schools open or reopening schools, and a number of really valuable ways that we can do so. So it is now my honor to introduce a series of speakers. We're going to hear from a number of UNESCO member state representatives. And first, I'm going to call on a colleague from Japan. Mr. Yasushi Taguchi is the Assistant Minister and Director General for International Affairs in Japan's Ministry of Education, Culture, Sport, Science, and Technology. Mr. Taguchi, over to you, please.
Thank you for introducing me. I'm Taguchi Yasushi from Japanese government. First of all, I would like to thank the UNESCO Secretariat for hosting this extraordinary session of Global Education Meeting on post-COVID-19. Also, thank you for giving me the opportunity to make a presentation today. In response to the spread of COVID-19, Japan has been working to ensure to the greatest extent possible that children are able to learn in a sound and healthy way, while also ensuring the taking of infectious disease prevention measures. In particular, I'd like to share with you today our experiences so far in relation to reopening schools safely. In Japan, due to the spread of COVID-19, our ministry next issued a request on February 28th to all schools, including elementary schools, junior high school, high schools, schools for special needs education, and so on, to close temporarily from March 2nd to start of the spring break. At the time of March 16th, more than 98% of the schools were closed. After the spring break, the government declared a state of emergency on April 7th, and this came to be applied to all prefectures on April 16th. Most of schools were temporarily closed until the end of May. In order to ensure that the children's learning would not be significantly delayed during the temporary closure of the schools, we provided support to help the children learn through a combination of home study using ICT and face-to-face learning, instruction or monitoring, which conducted through special attendance days and home visits by teachers. At the time of June 1st, when the declaration was lifted, about 98% of schools were reopened, and now they are all fully open in Japan. For the reopening of the schools, our ministry provided guidelines named infection control manual for schools under the new lifestyle on May 22nd. This manual includes following 7 contents for appropriate countermeasures to COVID-19. First is the basic policy, which says that we should find a way to implement appropriate infection controls in accordance with learning contents and the local infection status in order to ensure opportunities of children to learn in a sound and healthy way. Second is instructions and guidance to students, including wearing masks, hand washing, and so on. The third is measures to reduce the risk of outbreak, such as ventilation, disinfections, keeping physical distance, and so on. Fourth is what to do if an infection occurs. Fifth is the role of schools and the communication with local health centers and hospitals. Sixth is coordination between schools and households. The last seventh is examples of specific infection countermeasures in various situations. In addition, we have put the basic idea and our various supports together as one consolidated policy package and published it as the comprehensive package for ensuring children's learning. There are following four basic concepts in the package. First is continuous learning even during school closure. Second is step-by-step approach to reopening schools. Third is recovery of learning by all possible means. And fourth is flexible countermeasures in order to ensure learning that can be only done at school as much as possible. Based on the provided package, in order to make up for the delayed learning due to the extended school closure, each school in Japan worked to maximize learning unique to the school by revising the timetable, reviewing the length of long vacations, and having classes on Saturdays when the schools are usually closed, while giving the consideration to preventing the spread of infection. In this way, we hereby commit to continue making every effort to guarantee learning opportunities to all children in our country to ensure that no one is left behind. To find out more about our comprehensive COVID-19 countermeasures, I would like to ask you to take a look at the education in Japan beyond the crisis of COVID-19, Leave No One Behind leaflet, which can be accessed from our ministry's website. Thank you.
Thank you very, very much, sir. That was really helpful to hear in more detail, and particularly those last 4 points. And I wonder whether we'll hear more about recovery of learning, which is something that UNESCO Global Education Monitoring Report has been really stressing. Thank you. It's my pleasure now to change continents, and I'm going to welcome Ms. Nalova Nyonga, who is the Minister from Cameroon of the Ministry of Secondary Education. Welcome from Cameroon, Madam Minister.
Thank you very much for giving me the floor. I'm quite pleased to take part in this seminar. I'll start first of all by giving you the strategies that we're using right now. Strategies which I think will be permanent no matter what time we are dealing with, except of course after the pandemic. And those strategies, our speakers have already touched on them, but I'll just line them up. Hand washing, basins. What we have done is have put hand washing basins dotted all around the campus. Water towers with taps at the bottom of them, hand sanitizers, face covering masks covering the nose and the mouth, the thermoflash for temperature of children and staff in case they have it, and of course, social distancing. And here we started by having a specific number of children per class when it came to exam time, and also it changed when it came to ordinary times. So that was social distancing. These, as I said, are points that we will have to continue no matter what time we are dealing with, whether during the pandemic or after the pandemic. Now, I want to say that as times went on, we have had problems in education. And the problem is, what kind of, the question is, what kind of problems did we have in education? That is the pre-COVID era. We've had problems with overcrowding, had problems with under-resourced areas in human resources and infrastructure, under-scholarization, lack of access, very little schooling in conflict areas. As you know, we've had conflict areas in the northern part of Cameroon and in the western part of Cameroon, English-speaking part of Cameroon. We have teenage pregnancy and drug abuse, dropouts and search for riches through scams, and the issue of misuse of technological tools like phones. And phones are very profuse all over Cameroon. About 90% of the total population have mobile connection as far as phones are concerned. And the question is, how can we use these phones more profitably? Now, come COVID, the question was, since we had a lockdown, how could we use this technology and other strategies to make sure that our children went to school, to make sure that we avoid a blank year? Because as many of the parents were afraid of a blank year, many also wanted to make sure that their children went to school. How did we create the balance? First of all, we conceived education as secondary education as the baseline in the country's educational planning. And so we had to look at it as being very important to prevent immature and non-sustainable decisions being made by youths. We also saw it as something that would help us achieve international standards in Cameroon, and that it would help us improve on access. Now, therefore, what happened was that as we went into lockdown, we knew certainly that distance education was the answer. That is how we took on distance education as the next thing to be done, even while the country was in a lockdown. And so we were able to use the distance education to make sure that we improved on teachers' input as well as learners' output and performance. We made sure that we caught up with areas of schooling that we had not done, and made sure that all the gaps were covered, as well as some socio-cultural gaps, which were also covered through the insertion of a non-curricular lesson. Those are the things that we are going to use now when we start distance education. Now, I want to say that the important thing, what we have seen, is that the measures that we have put in schools have worked. The first one was during the examination period, when we put all those measures that I said I listed before at the start of my talk. It worked because we had no cases, no child deaths, neither in secondary nor in primary education. Totally successful. Now, here we go now with another period, the full-fledged term time, when we have more students, and our fear is, are we going to have the kind of success that we had at the beginning of the year? Now, it's a matter of guesswork, but we are very certain that as we succeeded before, we are going to succeed this time as well. So distance education is a point that we have achieved right now and will continue to achieve. The schools are practicing a mixed or blended learning, as the case may be. Some schools are doing it at different levels, but the important thing is that we're guiding them on the times when schools open, when they close, in the morning and in the afternoon. And that is helping everybody. At the same time, every school, whether you're opening in the afternoon or in the morning, you are testing the children. and making sure that all the children who are coming to school are COVID-free. I want to also indicate that what is giving us our success are certain poles of performance that we have identified. And that has to do with, first of all, beginning with what we call the clean school. It is a concept that helps us try to achieve a success school, pedagogically good, innovatively active. A clean school or green school that is an ethical school, which has a civic spirit, a moral behavior, all fighting fraud. We have under clean school, the inclusive school that takes into account cultural diversities and integration of learners and gender equity and multiculturalism. We have under clean school, a secure school that is safe school, health and cleanliness, installation of cameras to fight against insecurity, a clean environment. We have clean school or green school that also takes into account green spaces, the consideration of green spaces and raising consciousness of the environment. Those are things, that's one pole of it, the clean school. Another pole of it is the distance education, which I have already talked about. And the distance education increases digitization, which makes children all conscious of how to use the digital education to improve on their education. We also have what is very important, health and nutrition. At this point, a health policy which is drawn up between MinSante, the Ministry of Secondary Education, and the Ministry of Health. And in here, we're building school infirmaries in all the schools to ensure that health. We have guidance counselors. We have temporary isolation units just in case we have cases, and algorithmic procedures for cases that are detected in schools and monitoring teams, etc. We have a policy that is called mobile money that also takes care of the moral aspect and how to pay money in the schools. Now, that is to say that all these poles seem to be interactive. At any point when you pick one, you're certainly going to touch on another one. This is what helps to give stability to the schools. And that is what we think will make us extremely successful. We are hoping by now, we open 5th of March. We have had no cases. We're hoping that we shall continue with no cases, no mortality, if possible. And we think that will be fine for us. Thank you very much.
Honorable Minister, thank you very much for sharing this comprehensive strategy that Cameroon has been following. I think I want to remark specifically on how you're working to uphold the values that you spoke about, clean and green, et cetera, even during a pandemic. And we wish you the very best with continued success with those mortality rates being what they are. Thank you very much. I'd like to now turn to a third representative of UNESCO member state, and we'll hear now from Ms. Elsbeth Aller. She's the head of the Secretariat in the Ministry of Children and Education in Denmark. Ms. Aller, over to you, please.
Thank you very much, and thank you for the invitation to participate here. COVID-19 in Denmark has been a challenge like everywhere else in the world, I'm afraid. But to us, two key points have been communication and cooperation. If I begin with cooperation, we have been very, very closely communicating with the key stakeholders, and that includes the organizations of teachers, students, parents, school leaders, municipalities, and they are the school owners in Denmark. We've been consulting them frequently and sometimes at very short notice, both on the guidelines developed by the health authorities and the Ministry of Education to get their input on what might need to be changed, and also on how does this actually work in practice. And so that's the cooperation part that has been, we believe, essential to the success of our handling so far. Communication-wise, based amongst others on exactly the input from the stakeholders, we've been able to elaborate Q&As on our webpage. We've had a hotline, both by email, but also a phone hotline. And based on these inputs, we've known which are the questions in the schools that need answers. So do we need to somehow change our guidelines, or do we need more Q&As on these specific questions that parents, schools, students have? So communication and cooperation, I do believe, are the key tools that we've used and still use. So this pandemic isn't over yet, and we do see still cases in Denmark, and therefore we still need to cooperate and communicate. After reopening completely, which we've done this summer, European summer, so recently, our next steps focus on surveillance and local action. So depending on the local situation, action is taken. So in some cases, a small bubble, as mentioned before by Mr. Banjari, the bubbling principle has been taken into action. So maybe a small bubble of children will be sent home. If there is a case, it could be an entire class, a year, and an entire school, depending on when we track and have our surveillance on the actual situation, what makes the most sense. So individual actions based on the local situation. And we also focus on maintaining our, we believe, high level of education. And we still have strict requirements in all schools, very much focused on hygiene, so cleaning, very often cleaning, and hand hygiene. So these are the two major tools in the actual school days used here. And of course, cleaning isn't, extra cleaning doesn't come for free. So an allocation of funds for this to be done in the schools has been made by the Danish government. Now, to the question just before my time runs out, how will we take forward the commitments in the draft 2020 GEM declaration? I mean, we still and always will see education as crucial in enabling students to have a good and successful life. And despite the financial hardship that COVID has caused, we'll continue to prioritize education and to not cut funding. And we've already taken several steps in order to, in our recovery plan, make sure that we align with the commitments of the declaration. And we will continue to meet the benchmark of 0.0% of GNP for official development assistance, and the benchmark of at least 6% of GNP on national education. So those at least are the commitments here. We will continue to do that. Thank you for your time.
Ms. Aller, thank you very much for sharing with us the response that Denmark has been making. And again, maintaining certain levels of certain standards, health and sanitation, but also educational standards, and continuing to prioritize education. It's very important. Thank you for your watchwords of cooperation, communication, surveillance, and that leading to local action. Thank you very much. I'd now like to turn to our fourth and final speaker of the formal panel, and this is Dr. Nicola Gray. She's the UNESCO Chair in Global Health Education and Vice President of the International Association for Adolescent Health. Dr. Gray, over to you, please.
Thank you so much. So good to be with you this afternoon. I'm just putting up one slide. Oops, I'm trying to. Super, I hope you can all see that. The UNESCO Chair in Global Health and Education is a community of professionals, and we're from education, public health and healthcare and beyond. And we look to increase intersectoral capacity to benefit children and young people in their schools and communities. We connect knowledge across sectors for the benefit of children and youth, and it's a privilege to share our scholarship and research with you today. The pandemic has thrown very sharp focus, shall we say, on our mission. But let me take you back to 2016 first, which seems a world away now, going back to some of our basic arguments for education. In that year, the Global Lancet Commission on Adolescent Health and Wellbeing published the results of many years' work by their collaboration. It was led by eminent scholars from some of the world's best teaching hospitals and research centres. And what was their consensus on the single best investment that any government could make for the health and benefit of its youth? It was guaranteeing and supporting access to free, quality secondary education for all adolescents. Yes, we would agree with that. And it must be inclusive, equitable, and sustainable to make it resilient in the face of crises. Now, the analysis that supported this recommendation showed positive impact of secondary education on outcomes as diverse as enhancing cognitive abilities among youth, improving their mental health, and even lowering risks for non-communicable diseases later in life. And for teenage pregnancy, one analysis showed that every additional year of secondary education for girls was associated with 9.2 fewer births per 1,000 girls per year. And this is not dependent on having a super health curriculum or environment, although of course that brings extra benefits, but by simply bringing children into education and keeping them there for as long as possible, that has benefit. And that is why it was their number one priority. They highlighted another protective factor in many studies of child and adolescent health, which was parental education. A higher level of parental education, and in some studies, particularly mothers' education, gave their children better health outcomes over a range of indicators. The Commission coined the term the triple dividend, and education gives us a superb example where investment benefits adolescents now, in their future lives as adults, and for their children as they become parents and carers. So that, for us, is why schools are now the extended front line of the pandemic. And we believe they must be the last setting to close, the first to reopen. For disruption now means an impact on the education and health of not only our current children and youth, but of their children. In May and June this year, the UNESCO Chair conducted a survey with our community, and almost 200 professionals from 42 countries responded. They told us how they were coping and how they were making sense and implementing their guidance. And as has been said before in this session, perceptions of success came from that close collaboration between school teams, local authorities, and families. Our respondents described many disinfection procedures for students, but not as many measures for the adults in schools, such as social distancing in staff rooms and offices. So we believe that it is useful now to turn the spotlight onto teachers and other adult team members, including administrators, cleaners, and canteen workers. There are two reasons for this. One is because they are most at risk in terms of infection and serious symptoms, so they have the right to a safe place to work with the resources that they need to do their job and the retraining needed to embrace rapid developments in remote learning, for example. But they also have a responsibility to protect the school setting to avoid closures. There's an August 2020 report from Public Health England, and it shares information about infections in schools during June and July, where some schools in England reopened for a mini term for target groups of students, including those in the run-up to national exams in 2021. 22 out of the 30 outbreaks they studied started with staff. The report recommends more stringent infection control measures between staff in school. And they said staff members need to be more vigilant for exposure outside the school setting to protect themselves, their families, and the educational setting. So we believe by empowering and equipping staff in school teams, we preserve education and protect the triple dividend. Thank you.
Thank you very much, Dr. Gray. I appreciate that very much. In the program now, we are, well, can all give everyone a virtual round of applause. Thank you. I think that the 4 panelists have helped us better understand the experience in a number of countries, but also the research that is guiding these actions. We now turn to the program session in which we are going to open it up for questions. I'm asking, please keep your interventions brief, but I have the pleasure of first calling on Honorable Minister Jean-Francois Roberge from Quebec. He is the Minister of Education. Honorable Minister, over to you first. Thank you.
Merci beaucoup. Merci pour ces rencontres, ces formations.
Many thanks. Thank you for this these beautiful meetings that we're having, allowing you a few minutes to find the interpretation button. I'll try to be brief. I simply have a question. The situation in Quebec is quite dire. Many cases. In Quebec, we have over 1.3 million students as we speak. 1,900 of them had a positive diagnosis. We have about 50,000 classrooms in Quebec with students younger than 17 years old, and over 1,000 classrooms are now closed because we applied a concept of which Mr. Banerjee spoke earlier, the concept of the bubble. So now we know that when there's a case in one class, we don't have to close the entire school, but we can simply close one classroom for a limited amount of time. So now the amount of time is 14 days, after which the classroom can reopen. Unfortunately, the virus is present in all of the society of Quebec, and in schools, there's a limited number of transmissions, yet the virus is circulating. We are constantly closing classrooms, reopening classrooms in order to avoid losing control. We are not losing control, but the virus is present, and we have applied all of the measures applied by Mr. Banerjee, alternating school days, hand hygiene, ventilation, securing school transportation, cleaning, targeted isolation, staggering timing, bubbles, etc. We have applied all of those measures. My question is, how can we reduce the size of classrooms or the number of students in a classroom by maybe rendering school presence, attendance optional? And so maybe allowing some parents to keep their students at home, which would reduce the number of students in class. That would reduce the spread of the virus, but how can we maintain the quality of teaching when there isn't a teacher at home caring for these children? So for now, attendance is compulsory, but we know that in other places, schools are allowing their parents to keep their children at home. So maybe some of you can tell us how you can maintain a certain level of quality of services while trying to reduce the transmission rates in schools. Thank you very much.
Honorable Minister, thank you very much. I'm going to take 2 questions before turning it back to the panelists, if you don't mind. Thank you very much. A very interesting question. I'm sure others in the audience have the same in mind. So let me turn to take a second question. And I'd like to call upon Mr. Wang Dengfeng, the Director General of the Department of Health, Sports, and Arts Education in China's Ministry of Education. Mr. Wang, over to you. Okay, I don't hear from Mr. Wang, so I will just call on the colleague who had a hand raised, and then we'll come back to the panel. So we had a hand raised. Sorry, Mr. Wang, are you there?
No, sorry, Chair. I'm Qin Changwei, not Mr. Wang Dengfeng. I'm the Secretary General of Chinese National Commission for UNESCO.
Yes, our good
thank
friend.
you.
Yes.
I'm glad to join you. Yeah,
Thank
very interesting presentation. The reopening school is very critical measures for continual education. I care how to smooth the transformation of learning. It's very critical for children to continue their learning because the disrupt of learning during the pandemic. After that, when we reopen school, because during the pandemic, most students continue their learning online, but it's very difficult to keep the same outcome of learning. That's a very big challenge. I think I'd like to ask our president to share their experience. Thank you.
Thank you very much. Indeed, this is an issue every setting is struggling with. Thank you.
Yeah.
Let me add one more question before coming back to the panel, and that is, what can be done to bridge the large digital divide, which is widening inequalities? So a number of the panelists have talked about the varied strategies, but what specifically to address the widening inequalities? This is one question. This is a question that's very relevant for distance learning and also for digital divides, because we know that connectivity is not equally distributed. So I'm going to turn now back to the panel and ask if they would like to respond. Maybe you want to put your hand up because you're going to volunteer to do so first. Minister Yunga, would you please try to answer a couple of those questions? Go ahead.
Yeah, the question looks simple and as if complicated, but I think that we have done a lot of thinking on this. And what we have done is that the lessons and the educational material produced in all formats, that is to say print, audio, video. And so the material is actually sent to the remote areas where they don't have electricity, and it's ready to be disseminated in all available media. So they have this material everywhere. We have no problems at all. And now we're thinking of alternative energy. And this is why I think that UNESCO will be very helpful to us, because we're thinking of nanotechnology, especially in the north. And we think that when we use that, that will also help us to reach the remote areas. When I say it's simple, it simply means that we have thought about all of this, and our material is available in multiple media. So that is good. Distance education is also good, and we hope that all will have them, because our platform also has extracurricular activities like arts and music, hope organization, gardening, sports, games, etc. That is why for us, distance education is actually a booster. You know, not only does it reinforce, but it also boosts the learning for the children. And we can actually get in sociocultural ideas that children have missed in other settings. Thank you.
Okay, and before I let you go, could you also say something about health and nutrition? Because you mentioned that in your comments.
Very important for us, because we are trying to sign contracts with farmers, small-scale farmers who are producing especially fruits,
Yes.
you know, so that they can produce this, they can send these fruits to schools. There'll be contracts signed with such progressive farmers, beginning with my ministry, which is not a school, but we do have a restaurant where we are signing a contract with a farmer who produces fruits. And so we can have all the fruit juices and whatever we need. It's so important. We think that that will make the learners more equal to the task of learning.
Thank you. And of course, it has an equity dimension to it that's very important.
That's right.
I'd like to call on Dr. Valentina Baltag from WHO, who can answer, I think, help address the question from our Quebecois minister. Valentina? She on? Okay, I don't hear it. So let me give Valentina a chance to get connected. And let's see, our colleague from Japan, Mr. Taguchi, would you like to respond to any of the questions asked so far? Mr. Taguchi, you're on mute if you are trying to talk. Okay, we seem to have lost the connection there. Elspeth and Nicola, let me turn to each of you in turn to add anything. Elspeth, I think there's not surprising, there's a lot of interest in bubbling. And do you have any advice on how to reduce the number of children in a classroom and still, have everyone continue learning?
Well, the bubbles you can be in a bubble and still be at school. Mm-hmm. So being in bubbles, I mean, to begin with, when we started reopening, and just to address another question I saw in the chat, we introduced school to the youngest students first. And the reason we made that decision, that was of course a decision based on health and safety, was first of all that the understanding was that younger children were less vulnerable to the virus, but secondly that home teaching, distance learning for younger children was way more difficult than for the older students, plus a lot of parents were sent home and therefore also needed to support their children's learning at home, thus affecting their work capacity, to say it, which actually also has led to, is my understanding, more respect for the teachers' jobs when parents had all of a sudden to take over part of that role. So that's half of an answer to a different question, but one from the chat. Concerning the bubbles, some of it will be physical distance of, between the bubbles. Someone has in the chat talked about boarding schools as well, and there we also operate with primary groups, and they're allowed to be a bit closer physically than the rest of the students. So, but it depends on the local circumstances, I guess is the answer. But it is possible to have bubbles within the school, maybe using other rooms of the school or outdoor space, which has been a very, very important tool here to have as much learning outside as possible.
Okay, thank you. Thank you very much. I'd like to turn to Nicola, and in addition to the questions that were already asked, there's one that I think is especially has your name on it. And that is, how do we address the psychosocial issues and mental well-being of children who are the real victims of COVID? Right now, a lot of focus is on loss of academic learning, and I think you could speak well to issues of psychosocial concerns. Nicola?
Okay, thank you so much. I will come to mental health. I will add that to my list. Thank you. I was going to start with what you said about the digital divide. And we were pleased to hear from respondents in our survey this summer from all over the world. And what struck all of us was the potential and the use of radio and television in some countries, both for communicating with teachers, but also for putting learning materials out here. And I think the minister in Cameroon said this eloquently as well, by making materials available in a range of formats. But I think radio for me has always been an unsung hero of health promotion, and I wonder whether more can be done there to combat the digital divide. Then thinking about some of the issues of the potential for having a rotating door, a revolving door of children coming out of and into school, classes being sent home, a teacher being sent home. Again, people in our survey shared different strategies for this. There were some closure rules that have been put in place nationally, but then were implemented at school level, depending on, how many teachers or students had been affected, would determine whether one classroom went home or whether a school was closed. And it does get complicated. We have written this year with Sir Michael Marmot, and I know one of the things that he would say, being very concerned about inequalities when schools are closed, is that the test and trace systems in countries are really going to help us in this regard. So, for example, if you can get fast, rapid testing for students and teachers who are suspected having the virus, or indeed have had contact with somebody with the virus, that I think that will revolutionise most of what's happening, but certainly in schools. We've also had seating plans shared with us by some principals, especially in secondary schools, where they take note of where each student is sitting in a room, and that enables them to reduce the numbers of the group who are sent out of school, because they really are just looking at the closest contacts. And also seeing secondary schools putting more mask wearing in place in my country, I think will reduce the number of students that will be affected by any one index case. Okay, so let's come back to the mental health of children and youth who have been affected. I think that it's fair to say that this year has been a year of lost milestones, that there are joyful events in the life of children and young people that have been disrupted this year. Everything from proms to graduation celebrations to birthday parties to the little events and the big events in a child or young person's life that they may not get back. It's a once in a lifetime opportunity, and some that hopefully we will go back to. But I think that people have again used innovative ways of, I've heard of drive-through graduations in some schools that have the room to do that, where people were very creative and really trying to just make joy where they could and recognise achievement where they could. But it has been the breaking of connections between peers that has been particularly challenging. And so I think that if platforms are available where, we meet for lessons, that it might be worth thinking about how they can use those platforms to meet for pleasure and to spend time as they would do on the playground, speaking to each other, having quizzes with their teachers, just planning in some downtime and relaxing time for children and young people. And then when they are back at school, of course, to have some particular curriculum interventions perhaps, and input from health professionals in the local community that can support them and their teachers with this.
Yes, very glad you added, and their teachers. I think school personnel can be also suffering from trauma because of the confinement and the school closures, etc. Thank you very much, Dr. Gray. I'm going to plant one question to ask our country representatives to think about this, because it was only Ms. Allard, who mentioned the issue of financing. So the question is, I'm interested to see the connections between financing education and this session, because what are the struggles that we're having in safely delivering education from a financing perspective. And I'll leave you to think about that and come back to you. But in the meantime, I think we have our WHO colleague back, Valentina. So we had a question for you, Valentina. Is there any evidence that transmission has increased because of school reopening? Which levels should be prioritized in reopening between upper secondary or primary? And I think that you answered the earlier question in the chat. So let me turn to Valentina and then I'll come back to the rest of the panel. Go ahead.
Yes, thank you. Just checking, can you hear me now? Okay, good. So yes, I did answer at least part of this question in the chat, that today what we know for pooled analysis, and I want to emphasize pooled analysis because there will always be studies that show outlier results, and for us it's important to learn from the whole body of evidence. So for those pooled analysis, the risk of children being a case as a secondary infection case is lower than in adults. However, data are insufficient to know whether the transmission by children onwards is lower than by adults, but it doesn't seem to be higher. So at least it is the same as in adults. Now, back to school clusters. When those, of course, there were school clusters, they were reported in the literature and by the media, but when they were investigated, more often than not, the transmission was related by transmission by an adult, a teacher, for example, not by a pupil. So can there be cases in schools, even if all measures, recommended measures, have been put in place? Yes. And the reason why yes is because school is not an isolated bubble from the community. What happens in schools reflects what happens in the community. And if, for example, let's say we have a situation when the school perfectly well put in place and meets all the conditions outlined in the current guidance, but in the community, the transmission raises and the situation is worsening, for example, it is only a matter of time when children will have the infection. So yes, there is no perfectly, what we say, zero risk strategy, but a lot can be done by making sure that schools is a safe place to learn. Over.
Okay, thank you very much. So let me go back to the panelists who are representing their country. Again, it's the issue of financing. There was been a lot of reporting that education systems have suffered from national resources having to be transferred to deal with the health effects of the pandemic. And yet to reopen safely does require resources, as we heard. So could you say a bit about, how you've experienced this in your country, and I'll see if Mr. Taguchi is back and is mic operational? Okay, seems not. So let me turn it back to Minister Nyanga. Have you had to have some stern conversations with the Ministry of Finance in order to help finance the reopening of schools? Over to you, Honorable Minister.
Thank you. Yes, this is a very difficult area, as you can imagine. But it's good to know that we have a government which is very, very aware of how important the health issues are and the education issues, and therefore tries to find not a balance, but a way of financing the problems that we have in education. For instance, there are more extra hours caused as a result of the shift system. The double shift system causes more hours. The course writing for the distance education courses, it costs quite a bit. The equipment to buy, of course, the energy, and the infrastructure, all of that really raises the money very high. But I must say that for a start, we do have the government input. We also have cooperation, especially UNESCO. I must say that. We thank you very much for that. And we're still coming, because we're coming to nanotechnology, where we'll need more. But it's been a beautiful cooperative working life between MINESEC, between the Ministry of Secondary Education and UNESCO in this country. We also have parents who are quite aware that this area is so important, but also very expensive. And therefore they have an input in what we call a techno fee, which is just less than $1, but something is coming in from every child. You know, so we have all those areas of cooperation, but they're very little. We still need more. But something is happening in the area of consciousness.
Okay.
Thank you.
Thank you very much. So it's very much related to political commitment, as you said. Thank you.
Yes.
I'd like to call on Ingrid Engdahl, who's had her hand up for a very long time. Ingrid, would you like to ask your question?
Yes. Hello, everyone. My name is Ingrid Engdahl. I'm the Vice President of OMEP, the World Organization for Early Childhood Education and Care. There's not been so much said about reopening early childhood education, and I'd like to ask about that and reminding everyone that the best investment you could do is in the early years. The reopening of early childhood education needs to consider certain things specially, and it has to do with the age of the children. So even though we have common measures with other school forms, we have extra hand washing, we have smaller group sizes, we try to lower the teacher-child ratio, we have stricter sanitation, extra cleaning. We can't do the same thing of distance learning and social distancing as other schools. Due to the characteristics of the early years and the importance of relationships, gestures, hugs, physical contact, body language, and facial expressions are needed in early childhood education. And I'd like to call on you to comment the research and the teachers who especially talk for the most vulnerable of children who have problems, the ones with special needs or the ones who are vulnerable due to other circumstances. Thank you.
Thank you very much. And I know Ms. Aller talked about how much more difficult it is, early childhood, early primary grades, to have them continue to learn by distance. I want to squeeze in one more question before I go back to the panelists. We're running out of time, and I do want to be sure that we hear from our rapporteur. There's a question about special needs children, how to ensure quality education for these children and youth who are particularly vulnerable in the context of COVID-19. So I guess if you could, I'll do one round back, first with you, Ms. Aller, then Dr. Gray, and then finally the Minister Longa before wrapping up. Go ahead, Ms. Aller. Konstantina, can you take her mute off? Okay, I'll come back to you. Dr. Gray, go ahead.
Thank you. Sorry, yes.
It works now.
No, go ahead. You're now, we're focused on you, Ms. Aller, go ahead.
Thank you. It's not always working.
No.
Special needs children. One very important experience we made, or at least an initiative we took, was that during the close down, special needs children and children from vulnerable homes were allowed to actually stay at school to receive education, because we all know that there are children who cannot be taught by distance learning, or who have situations in their homes that makes it impossible for them to learn at home or even stay at home. So these small groups were allowed, and it was crucial that all schools, and it still is, had focused on each of these children and assessed their needs. Do they need to go to school? Is there a need for closer contact between the school and the home? So a special focus on those students all along.
Okay, thank you. Dr. Gray?
This is as where intersectoral work comes together. I believe that in early years, and particularly with special needs, that bubbling probably is the only way to form a community of adults and children who do not need to particularly wear masks and who can hug. But then that does place extra responsibility on everybody to try and preserve that bubble and to limit exposure beyond the school setting, to be able to keep those relationships going throughout a very difficult time. And again, we can only hope for fast testing and the vaccination to help us there. I was wondering whether I might extend that, because it has struck me that in some guidance that a lot of children and young people have been classed as vulnerable because of the fact that they've got chronic illness, because we know that there has been more serious symptom risk in those who have underlying chronic illness. But I think we're also knowing now that that it's not a homogeneous group, and that, you know, for children and young people who have well-controlled symptoms, asthma, diabetes, then we've been hearing from medical colleagues that they are quite well and able to go back. And in fact, it's better to keep their routines for their medicine taking, to have the school environment. One of the things that paediatricians in my country have been worried about is that some children will be homeschooled for longer because the family is worried. And so I think this is where we have to work together. And there are some good reporting templates that can help a medical team and a school team to work together with the family for the benefit of those children.
Thank you. And 1 minute wrap up of Minister Nyonga, excuse me.
Yes. Thank you very much. As I said before, we have one of our goals under the Clean School is inclusive school. And we do have a contract with one of the schools for secondary schools. So they still do face-to-face, and we rely on them very much on whatever suggestions they have to make. For now, there is no real problem. We're still doing face-to-face, and whatever they tell us, we shall be able to integrate that into our distance education strategies.
Thank you very much. Please, thank you to all the panelists, including the opening presentation by Dr. Banerjee. I'd like to now turn to our rapporteur, Ms. Carmen from World Food Program, in order to make sure that we hear back from Carmen Burbano about what she'll be reporting to the plenary. Carmen, over to you.
Okay, Suzanne, I'll do my best because the conversation was very rich, and thank you for wonderful moderation and for helping us get everybody's comments in. I've been busy scribbling the findings, and please let me know if everybody's in agreement with what I will say. So I think that one of the very important first parts of our conversation was the framing of the discussion that we got from WHO. And it's really important, I think, to put this on the table, that according to the evidence, the proportion of COVID cases among children is relatively low. And that evidence seems to suggest that children play a lesser role in transmission overall. So these things help to build a bit of a context in which the costs of keeping school closed are greater than the risks that we are seeing from the evidence. And so really what is needed is safe and creative ways of keeping schools open for many reasons. First, because of the learning and the access to education that children get, but also because it's a place where they can get services like nutrition, like health services, mental and psychosocial services. There are many reasons to keep those schools open, as we discussed with WHO. So we discussed with the different country experiences how different countries are balancing pandemic containment and keeping those services open, and how have their experiences been. I can boil it down to maybe 5 things that we heard from all of you. The number one is a lot of you mentioning safety measures and prevention measures that have been put in place in schools. This includes a lot of emphasis on sanitation, water, hand washing, social distancing, PPE measures, staggered meal times, and also a huge discussion around class sizes and this concept of the bubbles. So all of these measures to try and prevent and to make schools a safe environment for children to return. The second principle is ensuring the continuity of the education and recovery of learning of those children that may have lost access to education during the lockdowns. And I heard some of you saying meeting children where they are in terms of their learning, assessing what they need, where they are in their process, if they have special needs, assessing those as well, and providing measures to meet them where they are and help them recover. The third one that we heard is providing clear guidelines and policies from Japan. We heard a lot from this, but also from Denmark. Clear guidelines from teachers and students. But the most important thing is based on consultation and communication with those teachers, with that community, with those students. And taking a case-by-case approach, a context-based approach to the measures that are taken and to the guidance that is produced. The fourth one that I heard is also having clear protocols and clear guidance on what to do if there are infections in the classrooms and in the schools. Again, this concept of bubbles and this concept of reduced class sizes that may allow certain places in certain schools to close not the whole school, but perhaps the bubble, and send those bubbles home instead of closing the whole school. Might be a useful thing, but of course, as WHO reminded us, this is really context specific, and it really reflects the rate of transmission in the community and the decisions that policymakers need to make in terms of what to do with a particular case also has to do with what's happening in the broader community. The fifth one is restoring services that are available, especially for the most vulnerable children. These include health services, nutrition, and school meals. We heard a lot from Cameroon on that. And we had a discussion also on the need for psychosocial and mental services and attention to these issues. And again, we heard a lot of intersectoral collaboration. The Ministry of Education surely is the key to all of this, but we did hear a lot of reaching across to the Ministry of Health, to Ministry of Agriculture, and local governments as well. So the real importance of really bringing this as an intersectoral discussion. Finally, three things that I think we should highlight as well. One is the conversation that you brought on age groups. It's not the same when we're talking about preschool children, when we're talking about basic education children, when we're talking about secondary and adolescents. They each have their own needs. They each have their own rates of vulnerability to the virus, and also the considerations of when to open these schools and with what guidelines is very different. And that is something that you have brought up. The second consideration is the issue of financing, that as we reopen schools, it's not like we go back to where we were before the pandemic. There are a lot of costs associated with these different measures that we've been discussing. And so ministries of education are struggling, and we heard from the minister in Cameroon that there are costs associated to these measures that need to be looked after, and this can come from the government, but also from donors, implementing partners, and also the community itself. And the last one that I would say is that a lot of the pre-existing challenges before the pandemic are still here with us. And that includes issues related to poverty, inequality, issues related to infrastructure, violence in schools, conflict in the communities in certain countries. And so as countries are starting to reopen their schools, they're dealing with the added problem of the pandemic, but also structural issues that existed before. And so these are all some of the challenges that we're dealing with. I just want to maybe finish by asking if I could ask the group for an approval to, as I report back into the plenary. I was reading the declaration before I gave this reporting back. And one of the things that I'm concerned about is that in the bullet point of the declaration where it says reopening schools, I do think that this point of restoring services like health, like nutrition, like psychosocial and mental services is not well captured in the declaration. And so based on this conversation, I'd like your permission to say in the plenary that we'd like that bit to be strengthened in the declaration itself. Over to you, Sue.
Okay, thank you. I think the only way I can ask for input on this is with people to raise their hands. So if you are in support, I can tell you, Carmen, thank you for an excellent summary. Looking at the presenters, I see a lot of heads shaking yes. So I think we're in agreement there. All right. Participants, before you run off to the plenary, I'd ask that you could indicate your support for our rapporteur's proposal to put greater emphasis on restoring services. All right. I would like to thank you all now for being with us. Special thanks to all of our speakers. Thank you for your preparation and the depth of experience that you brought to bear on our conversation today. Thank you for your flexibility for a wide-ranging set of questions. I'd also like to thank our UNESCO colleagues who organized the session, especially Chris Castle and Conchal Chang. And let me put a special thank you in for the interpreters, because their work allows us to have a more linguistically inclusive discussion. So thank you to the interpreters. I urge you to all please go and join us in the plenary. It is time. Thank you again, and stay safe, stay sane. Bye-bye now.